Hello, Ergo-Flex family. It's Dr. Robbie Wyatt, Chief Clinical Officer for Ergo-Flex Technologies, home of the Knee On Trac. And I want to give you some specifics on exactly what you can explain to individuals that you're talking to about getting referrals for the Knee On Trac, specific to if they've already done, say, a stem cell allograft injection. Okay, so conditions that can be treated: basic sprain strains, basic meniscal tears, complex meniscal tears, ACL, PCL disruption, and also replacement, like a xenograft or an allograft, as all the way up to total knee replacements. Okay, and that includes partial knee replacements. Now, specific to more of a post stem cell injection, allographic stem cell injection, the benefits are this, is that as that joint capsule actually decreases, okay, what happens to the medial and collateral ligaments in the ACL and PCL is those ligaments actually begin to fold in on themselves, okay, because of the joint space losing. All right, well, that creates scar tissue adhesions in that ligament structure. Okay, well, when you put that allographic stem cell in place, it wants to regenerate that joint. It wants to increase the joint size. And if you have those adhesions in place, it's going to be very painful. Not uncommon that my patients, when they came back for their 1 week follow-up post allograft stem cell injection, is that a lot of times they had a limp that maybe wasn't there, or the significant alteration in their gait. And the exact reason is that joint space is trying to increase. If you got ligaments that are adhesed in a shortened fashion, then it can't. That becomes very painful when that joint actually starts to increase the volume. Okay, so the Knee On Trac specifically helps break up that interligament scarring. Okay, and it also helps to actually repair that ligament and increase joint space. That's the other big factor, okay? Knee tracking. Now, let's be real specific. Knee joint specific. We're not pulling from the ankle all the way up to the pelvis. We're pulling from femur, tibial plateau. Between those two is what we're working on. Now, when we do that and it occurs in extension, all right, we separate the condyles. Okay, so femur, tibial plateau, when they come together, there's condyles. So the femur has, it's a curve, right? And then on the tibial plateau, there's a cup. When they come together and they are not moving properly, the first thing that goes away is the screw home mechanism. Full extension, everything should lock in place. Okay, the tibia. Just lost the word. So the musculature behind the knee, the popliteus, oh my goodness, the popliteus should relax and allow that to completely occur. The Knee On Trac allows this mechanism to be separated, okay, gently and repeatedly. All right. Under load, sidestepping the muscle spindle and Golgi tendon apparatus for muscle splinting. That's what allows this gentle milking and imbibing action. Ligaments, also for the synovial fluid, also for the meniscus, okay? So when we have that gentle imbibing motion, that's what actually helps stimulate that allograft and stem cell to continue the process, okay? So in my experience, from a clinical standpoint, when we did just stem cell allograft and didn't do anything. We had several patients that worked out of the country. So they basically flew in, we gave them home care, they did the injection, and we saw them back 6 weeks later. Those patients had significantly increased pain and reduced improvement compared to patients that were on the Knee On Trac once a week for 8 weeks after the allographic stem cell injection. So at least a 50 to 75 improvement in how fast they repair and how much joint space they get back in a shorter period of time. Now, you're really going to look at joint space improvement over a 6-month period, but you're going to get the majority of those results in the first 8 weeks, okay? So those are some of the specifics that you can go to somebody that's already doing stem cell and saying, hey, you're just doing the injection, let me take care of them aftercare. Those are some of the things that you can talk specifically to them about. It increases outcome in joint repair. It repairs the way the ligaments are folded in on one another and have interstitial scarring. Promotes synovial fluid production through that imbibing action by sidestepping the Golgi tendon and muscle spindle apparatus. All right, guys, if you have any more questions, please let me know. I'll post this up so y'all can get it as soon as possible.